Hi, I'm Dr. Bill Cushing, and today I'd like to continue our discussion on procedural coding. The first thing I'd like to do is take a look at reimbursement levels, Medicare reimbursement levels, for new patient encounters. Now, Medicare will pay approximately $44 for a level 1 encounter. That's a new patient encounter. $75 for a level 2 new patient encounter. $109 for a level 3 new patient encounter. $166 for a level 4 new patient encounter. And $208 for a level 5 new patient encounter. The more complex the case and more demanding the documentation requirements are, the higher the reimbursement rate will be to the physician. The higher levels may actually limit the dollar return to the physician for time spent. Here's an example. Let's just say you see 6 level 1 patients in an hour. Your reimbursement will be approximately $264 for that hour spent. Now, if you see 1 level 5 patient in an hour, your reimbursement will be approximately $208. The return for the hour spent is lower, seeing the level 5 patient, than the return for the same time spent seeing 6 level 1 patients. Now, if your practice consists mostly of Medicare patients, you would be hard-pressed to cover the hourly costs of your practice at these rates. It will require very efficient management. You will find that you will need a good mix of private insurance to compensate for the lower Medicare reimbursement rates. If you see Medicaid patients, you will find these reimbursement rates even lower. Now let's look at an example of a level 2 visit. A 23-year-old patient presents with a complaint of a sore throat of 2 days' duration. The review of systems is focused. It is negative for fever. Patient reported mild fatigue. The physical exam is also focused. The patient is in no distress. Head is normocephalic, atraumatic. Eyes are within normal limits. Ears show normal external canals and normal tympanic membranes. The throat is positive for erythema without exudate. The neck has mild lymphadenopathy. The lungs are clear to auscultation. And you've come up with a diagnosis of viral pharyngitis. Your plan is to push fluids, tell the patient to rest, over-the-counter analgesics for soreness as needed, and to return to the clinic in a week if no improvement. The time spent with the patient was 15 to 20 minutes. The history was problem-focused. The physical exam was problem-focused. The medical decision-making was not complex, but relatively straightforward. This justifies a level 2 new patient code of 99202. Now let's take a look at a level 3 visit in the next video. Well, I hope this helps. Have a good day.